Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. What a beautiful fall day. Absolutely stunning. It's a day to go play. But after we get done with the program, not too soon, unless you want to go out and listen to us there, you can carry your phones with you and your portable radios and all kinds of things. But we're here for you. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We have a topic we're going to talk about, but if you have something that you'd like to have cleared up, here's an opportunity. This is the place you get it done. And when we're not here at the studio, if you'd like to talk to us, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. Check it out. And by the way, take a look around it and walk around it, and go to our business store and see all the articles that we have there for you. But nevertheless, this program is for you, and the topic today is a very interesting one. It's called repetitive stress injury or carpal tunnel syndrome. What that means is when your hands go numb and they tingle, or you lose control, you can't grab anything, and you wonder where that's coming from, and your doc decides that you have to surgery, so somebody can pay for their car payment or their house payment. I mean, it's not necessary. There's ways of fixing these types of conditions. Repetitive stress injury, also known as repetitive stress syndrome, if you will, or repetitive stress whatever goes on, accumulative trauma disorder, I've heard it called. I've heard it called repetitive motion disorder, carpal tunnel patterns. They're all similar. And what you have to understand, that is, they affect a lot of people. We're talking somewhere between 10 to 15 or more million people annually, and it has a lot of different causes. And it's not just a compression, damage to the nerve roots as they go through. And we're going to talk about that very specifically today. And in studio to help me do that, and your host this Wednesday evening on this subject, on repetitive stress, Dr. Mathew Adams. Hello, my friend.
Hello. How you doing?
I am well. It's a great day.
It's beautiful.
I know. And we're going to talk about things that aren't so hot, because you can't pick up a golf club anymore. You can't hit a tennis racket anymore, let alone trying to write. You can't pick up a pen. And today's world of keyboards and all kinds of data-based everything, we have more and more of these repetitive stress problems. And in our field, doing the work that we do and dental work that many of our colleagues do, that also will cause a problem. But many of these things are basically set up for the symptom presentation.
Yeah, our bodies are made to move and to stand upright, and we tend to do things that don't allow us to stand upright. We're all hunched over, we're typing, we do the same thing. We work on patients, we're looking down, look at their spine, doing muscle testing. We do all kinds of stuff that puts pressure and takes away from our normal, natural ability to stand upright and move.
Even if you don't do a push-up the right way, you can jam that wrist. If you grab a hold of a golf club inappropriately, you end up with pain and discomfort not only in the arm and the shoulder, but also in the hand. And talking about arm and shoulders, repetitive stress injuries can cause neck, shoulder, arm pain as well, but we're kind of taking it from the other end today. So let's start this way. Dr. Matt, you're going to talk about it very extensively this Wednesday evening, but talk us through, if you will, what the symptomological characteristics are that would identify somebody as really having this problem.
Well, when you say this problem, you mean carpal tunnel, or this problem meaning repetitive stress?
Yes.
Yes. So typically when we look at carpal tunnel, we're looking more at some decrease in sensation, maybe some weakness in your thumb, your index finger, maybe going over a little bit of your middle finger. And that's about it right there for carpal tunnel. The problem is a lot of times we get numbness in the whole hand, or we get tingling in the whole hand or up into the palm, and we're like, well, I got carpal tunnel, I need to go check my hand out. Well, the nerve that runs into the wrist starts way up top, and it goes through all types of little tunnels and areas through the shoulder, through the arm, through the forearm, through the hand.
So let me get this right before you get into all that. So
gotcha.
when the patient goes to the doc and the doc says, or the patient says to the doc that my hands are numb, I've got to shake them at nighttime to wake them up, and he says, oh, you got a carpal tunnel, I'm going to send you to the surgeon. Not necessarily so.
Correct. Yeah. And that's what a lot of times happens. I don't know how many people I talk to that go talk to a doc about, not even just with the hand or carpal tunnel, but many symptoms, and they'll say, well, they didn't even touch me. Well, you've got to muscle test and figure out which nerves are not firing. Is it the pinky over there? Because that's a whole different nerve. Is it more the thumb? Is it maybe you can't bring your wrist up or down? And so you have to evaluate all these different things, especially before you're going to go and start taking some different medications or get something cut open, because then you're looking at recovering from that, and then it didn't fix anything, and you've paid a lot of money.
Yeah, unfortunately, the majority of surgeries don't fix anything. I mean, they have the problem again. Some of them do if it's a straight up carpal tunnel and it's a nerve root compression problem where there's been damage to that nerve. But the people that really get true carpal tunnel syndromes are people that are carpenters. They're hitting with hammers all day long, or they've got these automatic hammers that are jamming back into their wrists and their elbows. But that brings up a whole different story as well. When I grew up, my mother used to take veal, and there was an old hammer that she used to take and beat the veal, smash it on this cutting board and tenderize it. That's what she was doing. And I remember her complaining, and she was a hairdresser as well, so who knew what predisposed which, but her hands used to bother her index finger and her thumb. But those are the kind of things that we don't even think about, day-to-day problems that set up these types of conditions.
Yeah, and you think about the pounding. Okay, so what does that do to the bones in the hand that are getting jarred every time you pound? Or what is that, now you're flexing your wrist all the time when our body's made to open up and the muscles on the outside of our hand are supposed to work better. So there's a lot of different muscle deficiencies that we have to look at before we even look into carpal tunnel surgery, and so much can be done to help you. I've seen so many people come in with numbness in their hands, and you just got to find the source, find the cause, and not just go at what you think is the problem in the carpal tunnel.
There's an interesting presentation, if you will, that I see in the practice on quite frequent basis, and it's called trigger finger. And where the finger sticks, it locks, it won't open up, and it's usually the index finger, but it can be any finger. It can be the thumb, it could be the index finger. Those are most common, but that's a type of repetitive stress injury as well, and that's usually coming from the wrist or the muscles that go into them. We have to remember that muscles move bones don't move out of place by themselves, so we have to look at what that really is and where it's coming from. Also something called Dupuytren's contracture, where you see the tendon tightening real tight, and person can't open their hands, and after a while there's so much scar tissue, if it's not treated real quickly, that in that particular situation, the only thing that can resolve it is surgical extension of that tendon, and it's not necessarily pleasant surgery, and there's a lot of rehab that goes along with it. 888-630-9625. That's 888-630-9625. That's how you find us here. My guest in studio, Dr. Mathew Adams. He's going to be your host, your presenter at our in-house continuing education program this Wednesday evening, the 13th of November, 7:30 p.m. We invite you. These presentations are our gift to the community. There's absolutely no charge whatsoever. We'd like to see you there. We'll answer any question you have, whether it's on this subject or anything else. Dr. Matt will hang out and, take your questions on any subject, but his presentation is this. To register for the class, call us at 703-698-7117, 703-698-7117. Dr. Matt, let's talk a little bit about what happens with not only this carpal tunnel pattern, but how it affects from the wrist up. We've talked about it can happen from the neck. You can have a pinched nerve in the neck affecting the muscles of the arm and the forearm going into the fingers. But when it happens in the fingers. And you, a little while ago, said depending on the fingers tells you which nerve it is, and it's not always a carpal tunnel problem, but it can be what we call a repetitive stress injury. People who knit, who do close work, who do handwork of any kind, can end up with these problems as well. How can something like that, we can understand muscle tightness, but how does that actually go into these characteristics? And then in the second half of the program, we're going to talk about the fix, but right now, let's kind of use the divining rod to figure out how this all comes about.
Well, yeah, so if you picture somebody walking in a normal gait, you see how their arms swing, they're standing upright, and then you think about everybody else you see on the street with their hands turned in, they're hunched over. So whenever you start to lose some of the nerve firing to allow your hand and your wrist to move like it's supposed to, then the rest of your body starts to compensate. So now that's not moving as well, so now maybe your shoulders turn in a little bit more. And so what connects to your shoulders? Well, you've got muscles coming from your neck that connect to your shoulders. So now they're starting to pull your shoulders down. They're starting to pull on your neck. You've got nerves in the shoulder that are getting irritated, and they've got nerves in the neck that are getting irritated. So now your body is going, well, that doesn't feel good. So now I'm going to lean this direction a little bit with my neck to try to take pressure off of that. And so over time, that starts to change the direction of your spine. And so what happens when you change the direction of your spine? Well, now that other side that's been getting more pressure starts to get irritated. And so you have this compounding effect going up the body. And then maybe you don't feel it for like 30 years afterwards. And you ask yourself, why does my neck hurt? I didn't do anything. I don't understand. Well, it's the the little things over time that build up that lead to the big problems later.
Postural maladaptation to our environment, to the ergonomics. That's the whole area now where people our companies are paying thousands upon thousands of dollars for experts, if you will, to go into the workplace and look at the chairs, look at where their computers are, look at how their desktops are, where the mouse is located, and so forth, and putting people in postural patterns. One of the best things people can do, in my opinion, is learn to stretch and exercise, because you are an athlete in industry. You're an athlete in your workplace. You're an athlete in your home. And we don't look at it that way, and we do certain things all the time. Kids are locked into their iPads and their phones, and they end up with these thumb problems. They come in, they're swollen, they're sore. You can't even grab a hold of them. But again, we're talking about the same thing.
Yeah, we're seeing kids now with usually you see someone's neck is coming forward and straight in the past when they've gotten older and gravity starts to kind of work on you more. But now we're seeing kids who are leaned over at video games and cell phones, at computers all the time. I mean, in school, in class, wearing big backpacks. All that's causing our shoulders and necks to come forward. And then they don't start. But that's the thing, too, is we don't always feel the pain from it in the beginning. There's little warning signs that we just kind of shake off, like shaking our hands off, until it gets bad. And so all the ergonomic stuff you do definitely does help. But at that point, when you're already feeling the effects of it, it's probably been there for a while. And so there's some correcting you have to go in to do, along with the changing of your lifestyle and changing of your ergonomics and exercise and things like that.
Yes, I mean, as soon as your postural system changes, you start putting pressure on the disc spaces. So it's just like this feedback loop that starts developing. You have a problem that's causing, the complaint that you have. So you shift your postural pattern, you shift your body to try to compensate for it, and now you're developing a problem that potentially is even worse and more degenerative, if you will, if it happens to do with the spine over time. And I get patients that come in, as you do as well, where they complain of, in this situation, we'll follow it through, the hands and so forth, and they're tingling and then they're numb and so forth. And sometimes all I do is I have them bring their shoulders back and then I put their neck into a neutral position, and the pain goes away completely, which blows their mind. And I'll say, see, it's not coming from your hand. That's where the symptom process is. Where the pain is, where the symptom is, ain't necessarily where it is.
Ain't necessary. That sounds like where I come from.
Be careful. I know, you're Tennessee. You picked that up real quick. This is Wednesday evening, November the 13th, 7:30 p.m. Dr. Mathew Adams will be your presenter, your host, at the Roselle Center for Healing in Fairfax. Give us a call at 703-698-7117. Tell my staff you'd like to be there. Dr. Matt is a bright guy when it comes to all this stuff, and he'll show you how to deal with this problem. We'll be right back after some very important messages.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject you have in mind. We're talking about repetitive stress injury and carpal tunnel syndrome, those things that make your hands numb, that things that don't allow you to hold on, things that give you that trigger finger, things that give you Dupuytren's contracture, all of that stuff. That's a very common malady, unfortunately, affecting somewhere around 15 million people annually in this country. And in studio, my guest, Dr. Mathew Adams, your host this Wednesday evening at the Roselle Center for Healing, and he'll be presenting the topic carpal tunnel repetitive stress injury. But I think you're going to be surprised where it comes from and how easily it is to correct. And we're going to talk a little bit about some of the inflammatory pathway problems that cause it. But before we do that, Dr. Matt, I want to go to the phones. We have some people waiting. You can call us today at 888-630-9625. Karen, thank you for calling. How can I help you?
Oh, thank you for taking my call, Dr. Roselle.
Appreciate your patience.
I just turned 70 recently, and I broke down and went and got the shingles vaccine.
I'm sorry.
I'm sorry, I didn't mean to put it that way, but
I did, though.
I don't get the flu vaccine ever. You know, I'm very healthy. I don't take any drugs, but I knew a handful of people that got shingles in recent years, and one very recently, and it scared the heck out of me. So I went and got the shingles vaccine, and I was just wondering what your thoughts on that is.
If you had talked to me beforehand, I would have talked you out of it.
Oh.
Having said that, let me tell you why. The effectiveness rate of the shingle vaccine is as low as 25%. And it's usually with people who haven't had chickenpox. It's the same virus that you got chickenpox with if you did get them when you were a child.
Yeah, I've had chickenpox.
So you already just the virus in you. So just think through the process. Think like my brain works a little bit.
Sure.
If you already had the virus in you, why would you put the virus in you again?
Right.
Okay, so the reason that the virus becomes activated, all viruses are transmittable, they're infectious, they're contagious, you can pass them to another person when you get this shingles shot. If you, kiss somebody, you have a potential, if their immune system is low, passing it on through the mucous membranes, because at that point it's an activated virus. But nevertheless, the rate of infection of the shingles due to the virus being dormant from the chickenpox virus and giving you the shingles shot, which is the chickenpox virus, is pretty parallel. So it doesn't do anything. It all has to do with immune function. If your here's what vaccination is based on. If you get injected with something, okay, whatever it is, at a very, very low dormant stage, it's called an attenuated virus. It's designed to trigger your body's immunological reaction to that entity, that virus, whatever it happens to be. if your immune system happens to be depleted, then guess what happens? Your risk of actually getting it increases. So you're just overburdening your system again. What you want to do is your IgA antibody, which is your mucus secretion antibody, it's your first line of defense. It's, your spit and the mucous membranes of your stomach and your intestinal tract and so forth. That's where your primary protection comes in. Then if your body fails there, then it has to go to the IgGs, IgEs, IgMs. They're just terms that mean different types of immunological reactions within the body. So the whole idea is to keep your immune system strong, neurologically, biochemically, emotionally. We have the old concept stress kills. It's because it begins to, body doesn't know the difference between good stress and bad stress. So any kind of stress that's prolonged over a period of time where you don't have the capacity to relax and repair, and God forbid your nutritive basis isn't good underneath that, is going to leave you more susceptible, and if there's injury underneath that and pain, more susceptible to getting all this junk. There are people who can get exposed to everything. They can kiss somebody with smallpox and hang around them all day long and never get the disease. It's because their immune systems are so strong. People have been exposed to AIDS and HIV virus and herpes and so forth and never get the problem because their immunological system is supportive and strong. So as long as you're okay right now, what I'm going to encourage you to do is crank up your vitamin C, make sure you're not getting a lot of sugars in your diet right now, and make sure your health generally is good, low-level exercise, and that should help you, Karen. If you'd like some more information, I'd love to go back and forth with you. Just write me at rosellecare.com. I'll send you back, and I'll send you some reference sites. You got it. You did it. Now increase your immune system. Karen, thank you for calling. I appreciate it. Dr. Matt, that's something we can really talk about because actually with vaccinations, the topic we're talking about, numbness in the hands and tingling and that sort of thing, can come about from vaccines.
Oh, yeah, you've got Guillain-Barré, which is a very common side effect from multiple different vaccines, especially the flu vaccine that can happen. It can cause tingling and numbness in both hands due to it's breaking down the nervous system, basically. Well, hold that thought because we have to break for the news coming up now pretty quickly. And when we come back, we're going to talk about some of the inflammatory pathways. We have several more calls. Love to take your phone calls. Don't go away. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630-9625. Dr. Mathew Adams, my host, or your host, my guest, this Wednesday evening. You are my host. The 13th of the month, he's going to be presenting a night on carpal tunnel repetitive stress injuries. So if your hands are going numb, or if you have trigger finger, or if you have Dupotrons, or you wake up in the middle of the night and you got to shake them to get back to sleep because they hurt, this is a class that you really don't want to miss. Particularly, skiing season's coming up, and whether you're a cross-country skier, or downhill skier, or getting out and having a snow shovel this week. Did you hear that in the news? Like Dr. Matt, it's supposed to snow next week. I know. I can't believe it.
It's ugly. I hope they're lying to us. Because I looked up and I saw, it's supposed to be moderate and nice and so forth, and then another website says, forget about it. I don't want to talk about it. I need to go back to Western New York. 888-630-9625. Let's go to the phones. Sandy, how can I help you?
Hi, Dr. Roselle. You mentioned just before the previous break something about a tight tendon in your hand that sometimes might have to be clipped, and I think that's what I have. I have no effect of it, but it's just there. And when I saw my doctor back in July, she said, "Oh yeah, it's a tight tendon, and we'd have to get somebody to stimp it if it bothers you."
Well, Sandy, here's the deal. What I was talking about is something called Dupuytren's contracture, and when you look at the palm of your hand, you're going to see this tendon just kind of tight, and it's going to draw your finger down, so you can't extend your fingers completely.
That hasn't happened yet. I have complete flexibility.
Okay, so you're still fixable. That's not a problem. That's an easy fix. Dupuytren's, once they get that tight where it's pulling the hand down, you can see the tendon bulging. At that point, if there's a lot of scar tissue in there, you try things like acupuncture and laser and ultrasound and so forth, but if that doesn't work in the condition that I'm talking about, then you've got to do something about it surgically.
Okay.
But in the condition you're talking about, and it doesn't show up that way, manual therapy can be very significant, and it can work and can resolve the problem.
Okay, so if I have no effect, it doesn't affect my use of my hand. I have no pain, no nothing. It's just fine, right?
Right. And it's
Okay.
if there's nothing there, if the tendons are tight, then you may have either the muscles are misfiring going into your hands. That can come from the neck. Or you can have what Dr. Matt and I were just talking about, something called muscle reactive pattern. That means that when one muscle is meant to relax, it's not, while the other one is contracting.
Right.
So you have to reset them, and you do that manually and also with nutrition, and it does a great job.
Okay, so the only reason I know that I have it is because I have a lump about an inch down from the last knuckle on my hand. In the palm of my hand, I have a lump, and that's what the doctor just.
Yeah, you have the beginning stages of Dupuytren's contraction. Now's the time to treat it.
Okay.
Okay.
All right. Thanks so much.
You're welcome. Thanks for calling. So, Dr. Matt, this Wednesday evening, we're going to do this whole thing. We got a couple more calls. We're going to get to them. But let's talk about this Wednesday evening's presentation just a little bit. There's problems that come about with repetitive stress that have to do with, if you would, biological predispositions, people who are arthritic, people who are diabetic, people who have adrenal stress patterns and so forth. All of those are consistent with ligament fascial conditions.
Mm-hmm.
Okay?
Yeah, so whenever we have some of the things you've mentioned, like adrenal issues, thyroid problems, they do affect our ligaments and can cause us to have ligament laxity, which is real detrimental to all our joints. Just thinking about having loose ligaments, you think about things moving and more than they should. Well, you've got ligaments holding your wrists and your shoulders in place, and they need that to form tunnels, to form areas for the nerves to pass through. So if we start having problems with our laxity and they start spreading out, when things start to spread out, it starts to pinch on the nerves passing through. Also, you look at some of the inflammatory patterns. Anytime we have area that has fluid running through, if we have inflammation, that increases the pressure, increases the fluid, and that, again, is going to cause pressure in those areas where the nerves are passing through. So you have to look at all the biological areas, too, whenever you're trying to figure out why is my hand numb or why are both my hands numb. And that means something, too. If you've got two hands numb versus one hand, that tells us some things as well. Typically, you're not, I don't know how often you see carpal tunnel with both hands at the same time, or all the fingers at the same time, or do you see one or the other?
No, I see quite over the years with many patients, it's not just one hand unless it's a truly traumatic type of problem where somebody's a bricklayer or uses their hand to hammer with, or they're on a mouse all the time, or that sort of thing. Then it can be one time. But when you have both hands involved, it's usually neuromuscular, and it usually has to do with deficiencies in biochemistry and so forth, and structural problems stemming from the upper part of the back and the lower portion of the neck. You fix that, as you know, they go away, and they go away very, very quickly. This Wednesday evening, Dr. Matt Adams, your host, your presenter at the Roselle Center for Healing. We'd love to have you as our guest. As always, absolutely no charge. We do require a reservation because we only have limited space, and once it's filled, it's filled. Give us a call at 703-698-7117 and reserve your seat today. I want to go to the phones because there's a man who's had some surgery and he's got pain, and that's the kind of thing I've been talking about. So, Vic, are you there?
I am. Hi, Doc. How you doing?
Good, my friend. Tell me about it. What's going on with those hands?
Okay, about 4 years ago, I was at work, and I went down a flight of steps, and my knee gave out, and I tripped down the steps and hit both hands on the cinder block wall. I didn't think any more of it, and I moved to Florida, and about 2 years ago, I went to see a hand surgeon. He told me that I had carpal tunnel in both hands and what they call, Guyon's canal release.
I'm not following what you're saying.
Guyon's?
Okay. He told me the problem because my little finger had severe pain down both little fingers in my head. So he operated on me.
That's not carpal tunnel, by the way, but go ahead.
No, but he operated for carpal tunnel and this. And then about a year ago, I started having problems. But here lately, the pain has gotten so bad that at night it wakes me up. I can't make a fist, and I use heat for treatment, but nothing's working. And I'm just trying to figure out what the next step is. Do I have to have additional surgery?
The chances are no. Let me kind of walk you through this a little bit. A carpal tunnel, when you hit like that, you jammed the carpal bones, you jammed and spread the two long bones of your arm called the radius and the ulna. There's a band that holds all that together. It's called, technically it's called a retinacula. It's just very heavy fibrous connective tissue that if you took a piece of tape and wrapped it around your arm, that's what it looks like underneath your skin.
Right.
And so when you're jamming your hands like that, you're compressing the carpal bones and you're spreading those two bones. And just to do surgery, in my opinion, doesn't make a lot of sense because you set patients up for problems like this. Now, the band is gone. You don't have the capacity to hold those two long bones and the carpal bones in place properly. And anything you do now becomes an excessive stress pattern. So I see patients, unfortunately, with that type of side effect of surgery way too often. And what has to be done is that you actually have to test the hand neuromuscularly, see where the weaknesses and strengths are. You have to find out where the misalignments are within the bone. And it can, in this situation, go all the way up to your elbow and even your shoulder because of the type of hit that you took. And you have to deal with that. The fact that your little fingers were involved tells me that the problem is probably further up as well, and you did something to your neck and shoulders when you took that fall. But it's, first of all, don't do surgery until you've explored everything else that you can possibly do. The kind of work that we do with manual work and acupuncture and laser therapy and so forth is extraordinarily effective, and it can turn this stuff. We deal with a lot of professional athletes in the area that end up with these kind of problems. They fall, they hit their hands, quarterbacks that throw, basketball players that throw, baseball players that are throwing, and you can resolve these things. Surgery is absolutely the last thing. You may also have scar tissue now that's been built up in there, and it has to be treated, but it can be treated properly. You need to see somebody who can tell you, listen, it can be treated this way, and it can be effective. It can produce what they say they can produce, or they say, look, no, it's way too late at this point. But based on what you're telling me, you need to take the next step, and it's not surgery.
Right. Well, nothing works for pain because I've had heavy narcotics, and it doesn't even touch the pain.
No, it's not going to. It's not going to. You have an injury problem that's in there. The neurological system has a memory to it, and it's almost the same type of phenomenon as a phantom pain, where somebody has a limb that's amputated, but they can still feel the pain in the limb.
Right.
It's that type of thing, but you have to re-educate the nervous system and take off any irritation or pain that happens to be associated with that. But Vic, it's worth exploring. If I can help you, I'm delighted to do that. If Dr. Matt can help you, we're more than happy to talk to you independently. Give us a call or send me a note, and I'll see if I can send you a referral as well. Appreciate your phone call. Dr. Matt, what does that sound like to you?
That sounds to me like he's got, you take a hit like that with your hand, you've got the different bones in your hand, the hamate pisiform that'll shift around and hit right on that ulnar nerve, plus at the elbow, because that's the ulnar nerve. That's not even the median nerve, which is what we see with carpal tunnel. So that's a little confusing why he had that surgery. The ulnar nerve comes, and most people have problems more at their elbow with the ulnar nerve stimulation getting affected. And the fact that it came on a little bit later, we'd already talked about the repercussions of hand to shoulder to neck. It could be coming from there, but the constant compression is going to keep the pain there. The pills and the anti-inflammatories aren't going to take the compression off, and that's why the pain's going to stay.
No, unfortunately, when you continue to take medication like that, it actually can cause a more progressive degenerative change to take place over time. If you have something and it hurts and you numb it, it's like years ago, these guys used to play sports, football players, and they used to take them off the sidelines and inject them with steroids so they couldn't feel the pain. And the problem was now they really do damage. And that's the problem with any of these techniques. But what most physicians don't tell their patients after they do the surgery is that when they cut that band, and they cut that retinacula, that hard fibrous band that holds everything together, now when they do anything at that point, they've got to have a brace so they don't potentially hurt it again. And they have to keep those muscles in the arm and the wrist strong. They have to be like a vice. That band's there for a reason. Our Creator didn't put it there just because it was junk. It's there to hold things tight. Diana, how can we help you? Diana?
Hello. I was wondering whether there is any method to removing age-related brown spots that are appearing on my face.
I'm going to touch on the subject just very lightly, and then one of these days when I have Sue in here, we're going to get in depth. But from a medical point of view, there's laser therapy that will get it done, but you've got to go to a really good people. If you'd like a referral, get a hold of me at drtomroselle.com. However, what they're a result of, their oxidative damage to the tissue is a result of the body's inability to get rid of trans fats, saturated fats, oxidative damage due to certain types of foods and so forth. If you reverse the process dietarily, if you get your body very alkaline and you begin to do very specific detoxifications for your body, ionization foot baths combined with low energy light laser has the ability to modify them, not get rid of them, but they will definitely decrease the pigmentation. So there's lots that can be done. There's a soap that has some reishi spore in it that is very effective, and you put that on at nighttime. And as a matter of fact, if you go on our website, I think we have some, and you put it on and you let it dry on your face and leave it on there overnight, and it will decrease the intensity of those spots. So Diana, I wish I could get more in depth. It's one of those things that we could actually spend quite a bit of time on. But if you give me a shout out on email at rosellecare.com, I'll be more than happy to guide you through this. This Wednesday evening, Dr. Matt Adams, November the 13th, will be your presenter, your host of the Roselle Center for Healing, 7:30 p.m., talking about carpal tunnel syndrome, repetitive stress injury, and really anything else that you want to ask him about it and how it comes about and what you can do about it. But I promise you're going to go home with a whole lot of information. Need a reservation? All you need to do is call us at 703-698-7117, 703-698-7117. Dr. Matt, what's this whole thing about B6 and repetitive stress patterns? Why is that a issue?
Well, excuse me. Well, you have B6. We think about B12 and folate. The B vitamins are really, really important for our fascial health, really important for ligament health. And so whenever we, from a nutritional standpoint, start to get deficient in that, we start to have issues with fascial restrictions, with ligament laxity, things like that. And it's really easy nowadays to get those nutritional deficiencies because we eat things with no nutritional value on a regular basis, and then our body has to use what little we have to process the stuff that we've eaten. And we see that a lot, too.
Now, that all goes to a very old faithful pathway called the adrenal system, the fight-flight system that puts out steroids that maintains the strength and integrity of all the joint space in the body, and I had to cover that because I promised somebody we would. Be right back after some very important information. Don't go away. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio all day today for you. That's why we're here instead of outside playing. It's a beautiful day. 888-630-9625. That's how you find us every Sunday at 12 noon. And how you find us when we're not here is rosellecare.com. That's ROSELLECARE.com. And I promise you, we do answer. It may take me a day or two, but I will get back to you. If you'd like to get a hold of us right away, do you need some feedback? Call the office, 703-698-7117, and that's how you register for Dr. Mathew Adams' presentation this Wednesday, the 13th, at 7:30 p.m. on Carpal Tunnel, but also how you get to us. So listen, if you have pain in your hands and you're numb and you're tingling, whether when you're laying down at nighttime and you're sleeping, you got to toss and turn and so forth, or you're going to pick something up, or you have to shake your hands, or you put your hands on the steering wheel and you notice that they're going numb or tingling, you can't feel the ends of your fingertips, ask yourself a question. Are your neck muscles stiff and tight? Do you have an ability to turn your head to the right, to the left? Do you have difficulty raising or lifting anything? If the answer is yes to those things, then that hand pain that you've got is coming from your neck. And don't ignore it, because it'll get progressively worse and it'll cause other problems as well. But it can be a localized problem. It can be an extended problem. You know, Dr. Matt, I was thinking about it when Vic called and he was asking about the problems, the recommendations we had for his post-surgical pain. And he said that he had that little finger pain. I didn't think about it at the time, but when I grew up, there was a doctor, a surgeon, orthopedic surgeon that lived down the street from us, and his specialty was hands, elbows, knees, and so forth. And he came up with a procedure that took the ulnar nerve, which flows down this groove in the elbow, and put it someplace else. He got it, he cut the sheath, and it never made any sense to me at that point. It still doesn't make any sense to me. But what he did know, and here's the correlative, even though I thought the procedure was ridiculous, what he did realize is that finger pain, that hand pain, that elbow pain was not coming from the wrist. It was coming from someplace further up, and all he was trying to do is give the nerve more room, that ulnar nerve more room, but he really never fixed anything with it.
Yeah, I mean, he was processing it, but predominantly the people I see with hand and numbness and wrist, things like that, usually it's coming from the neck. It surprises a lot of people. You know, I'll test the muscles around the hand, and then I'll, like you said, have them move their head, or I'll just lift their head a little bit, and the strength will come right back, and they'll kind of wide-eyed look at me like, "What'd you do?" I didn't do anything. I just took pressure off the cause, found the cause.
That tells you exactly where it's coming from.
Yeah.
Daryl, how can we help you? Thank you for calling. I appreciate the phone call.
Oh, yeah. My wife has a bulging disc. She's had a couple MRIs in her neck, and she's got all kinds of neck pain. She originally had, she had carpal tunnel, I think, and all that lower arm pain and stuff like that. But really, she's had steroid shots, and now they're saying surgery is the only thing to do.
No, there's a lot more that can be done. We see that type of condition all the time. A bulging disc simply means that the disc is pushing on the outer shell, the annulus of that whole container that it's made of. You have the annulus on the outside, you have the nucleus on the inside. The nucleus is like toothpaste, and it's starting to push through because of an abnormal position of the vertebrae. Now, once the disc is herniated, where the nucleus actually leaks out and leaks through, sometimes you need surgery and sometimes you don't. It depends on whether it's central, whether it's lateral, and so forth, and all those things are a topic for a different show. But let me say this to you. Out of 100 patients, and we're going to use the number 100 patients, but the fact is 100 patients who have been diagnosed with disc problems of the neck and have been scheduled for surgery that have gone through conservative decompression therapy, manual modes, acupuncture, and so forth, over 70% of them can be resolved successfully without surgery. So there's a tremendous ability to reverse these things. We have a great neurological group that we use when patients do need surgery. These guys are great, but I'm telling you, we send 10 patients over there. They may do surgery on one or two, and they're going to send them back and say, no, they haven't had enough care yet. Send them back to talk to us. Dr. Matt, we've got a few seconds left. Talk to me a little bit about Wednesday night, what you're going to cover.
Well,
Thank you very much.
You're welcome.
Thank you. We're going to cover from the hand up to the neck. So even those bulging discs that can cause pain down into the hand, numbness. We're going to talk about the elbow, talk about the wrist, talk about the biochemical aspects, and basically anything you can think of that is going to cause hand numbness. We're going to talk about it. We're going to talk about how it happens, why, and we're going to talk about what we can do to fix it.
Sounds like a great night. We wish all of you could attend. Make sure you give us a call. We'll see you next week. Same time, same old place on your dial.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.